I'm with Dr. Marlain at King's College Hospital, and we're going to talk about a subject that not many women want to talk about, but it affects so many women. My first baby was £9.11, which is
4.2 kg, something like that.
okay. So I had issues with incontinence. I actually ended up having the sling thing, which was traumatic in itself, because you have to go to the doctor, you have to jump up and down on the towel until you basically wet yourself to prove that you need the operation, and then you prove it and then they let you have the operation. That's what happened to me. But that was a very long time ago. Max is now 27. Tell me, how many patients come and see you? I know it's me talking and I'm asking these questions, but I know so many women who have told me secretly that they have issues and they wear big pads and they won't come and see the doctor.
I think it's a very hidden problem. A lot of women come to the clinic because they want a general checkup, because they have a heavy period, especially women who are the perimenopause and menopausal women. And then at the end of the consultation, they will say, "Oh, doctor, I do have a problem with my urine. When I cough or sneeze
Or laugh.
I can't control it, or I wake up several times in the night." And when you start looking into it properly, I'm not a urogynecologist, but there is a strong link between the menopausal changes, of course the weight of the baby, and the damage that it caused to our pelvic floor. Urinary incontinence is a really complex problem. The bladder is a bad witness. So there is what we call the drusen instability, the bladder muscle just contracting by itself. And it presents itself by you want to go to the toilet. If you don't get there on time, you would leak. You would wet yourself.
Yes. You have to stand still for a minute before you run.
Exactly. Because the bladder is contracting.
Wait a minute.
And the treatment for that is actually some medication, some tablets, to make the bladder relax. However, other women, it's because of the pelvic floor weaknesses, because they had a big baby, 4.2 kg. It's huge. It's weakened the bladder floor, the pelvic floor muscles. Initially, when we are young, it's not a problem at all. Later on, when we get older, the lack of estrogen, the vaginal dryness, that is an extra layer that worsens the problem. So you had what we call TVT, or it's a tape that we put under the ureter, to lift it up and stop the woman
like
from...
a sling.
Yeah, it's like a sling. The problem with all these procedures nowadays, even they stopped it completely in the UK because of the complication from that tape. A lot of women had to have it removed because of the body rejecting it. But, as they say, prophylaxis is better than treatment. The moment we start having these problems, and actually the moment we start feeling the vagina is dry, we are having problems with the intimate relationship, with the dryness, we are passing urine more frequently, we need to have it looked into. So there is non-surgical options. I mean, the trick with everything is diagnosis, is knowing what we are dealing with. For example, if there is vaginal dryness, and usually it's women above the age of 40, if there is elements of vaginal dryness, we can use vaginal estrogen. It improves the vaginal dryness. If it is a bit as a mild to moderate pelvic floor weaknesses on assessment, then there is non-surgical treatments such as radiofrequency. It's so simple. It's a tube, you put it inside the vagina, and it heats the vaginal muscles to just 43 degrees. It's a 20-minute treatment cycle. It improves the health and the tissue of the vagina and the muscle. If you combine it with things like hair acid or PRP. It's not only for the face.
Hyaluronic acid, is that an injection?
There is different way of using it. You can either using it with the radio frequency, but as well you can inject it in certain points in the vagina. With the stress incontinence, the 2 points that we inject into the hyaluronic acid is around the urethra on both sides, and as well we inject the G spot and the O spot, and that all improves the health of the vagina and can improve the stress incontinence.
I did actually have PRP there, and just like I said, it didn't hurt at all.
No.
Weirdly, I was a little bit apprehensive. I can't say it helped an awful lot.
You have to combine it. On its own, it doesn't work. It only can help in mild and moderate stress incontinence. You have to combine it with hyaluronic acid or plasma, and you have to have a session every 7 to 10 days for a total of 6 sessions, and you would need to repeat another cycle after 6 months. So we all go and have all these facials, right, and hyphen and all, and Botox and everything. I've never had anything but but we need to address the vagina. We should not forget it, and vaginal dryness should be prevented.
Another taboo subject.
Yeah.
Now, if somebody comes to you and they say, I'm wearing these horrible big pads, I have real issues, are there options? If that sling is no longer available, you're saying there are non-surgical, but can you just say, give me an operation and sort it out?
So,
is there something available?
In Dubai, it's definitely still available. I think the first thing is to diagnose what's the problem.
Right. Assess
the pelvic floor muscles, which you can do clinically and with some instruments as well. And then potentially decide this lady needs urodynamic studies to assess the severity. We assess whether a woman is completely emptying the bladder or not with ultrasound before and after passing urine.
Yeah.
So it needs proper assessment, and depends on the assessment one can decide, should we try the non-surgical route? Does it improve? It does give, I wouldn't say it's the magic answer, it disappears. It does enough improvement to be able to function without being really stressed, without worrying, I don't want to go to the yoga class. It's, without wearing a pad.
Mm-hmm.
I can't go out, I can't wear a white trousers just in case.
Yeah.
This is all these things that women don't say.
Yeah. If you're in your 40s or your 50s and you're wearing a pad, for goodness sake, get it sorted. You've got to wear those pads for another 40 years. I can't think of anything worse.
That takes me back to hormone replacement. It's so undervalued and underestimated.
Mm-hmm.
You see, these problems with the incontinence, usually we see them in middle 40s, late 40s, 50s. Early on, if we start using hormone replacement, doing pelvic floor exercises, physiotherapy, all these non-surgical treatments, this stops the problem from getting worse. It improves it.
To be fair, all of that costs money though.
It is. I mean, in Dubai, some insurances, good insurances, would cover the radio frequency for stress incontinence.
So what are they doing in England if they're not doing that operation anymore?
Nothing. Nothing. They are leaving women to just run dry.
Which is why you see the ads for the big knickers on TV, because there is no other option.
Yeah.
Wow.
It's just unbelievable.
If men had it, that wouldn't be the case.
No, I think, to be fair, the fact that we have a problem with the meshes and we stopped using it, it's driving the research into the non-surgical options. And, not everything should be treated by a knife. There should be a non-surgical option.
There should be an option, but there should be, I think the sling, for me, it worked and it was brilliant.
It's fantastic. It works for a huge number of women, but you need to assess properly and go to a proper urogynecologist and explore whether the non-surgical option is going to be an option for you.
Right. Now, I know that King's has an Emsella chair.
We talked about that. So the Emsella chair on its own,
Which I have sat on.
yeah. The Emsella chair, basically what it's for, it's easy. You sit on a machine and on a chair that vibrates and makes your pelvic floor muscle exercise, like
Yeah.
a Kegel
Yeah.
exercise.
Yeah.
On its own is not enough. If you combine it, this is where the best way is to combine it with radio frequency. It's a 20-minute session, possibly with hyaluronic acid. The hyaluronic acid is once every 6 weeks or so. Radio frequency every 7 to 10 days. And you do the radio frequency and immediately you sit on the chair.
Right.
So the radio frequency improves the blood flow into the muscle, improves the health of the muscle in the vagina. It's like what we do for our face to improve the collagen. It's exactly the same thing.
Like
And then-
collagen, that's a whole other story.
And the Emsella chair is a top-up that exercises the muscle once you improve the blood flow in it. It's a combination. There is not one simple answer for it.
And this is just our bits. This isn't our face or our... I mean, this is just, it's mind-blowing.
It's the unspoken things, and unfortunately, these intimate issues of women. They don't talk about it. They suffer. It affects women's quality of life. But there is more and more women who actually are interested in the non-surgical option and the simple management of the vagina.
So there are options out there. Dr Marlain is your woman to start with, for sure.
We are definitely in King's starting it. Me and a colleague of mine, we will be starting this service shortly. We already provide a few things, but the radio frequency is something I'm so interested in. I've seen good results, so it's a fantastic thing to explore.
So
and see if it's something suitable for you.
yeah, look after yourselves and just think of those 30, 40 years you have ahead of you and do something about it, because there's just no point suffering in silence.
Interesting, one point, Arabic women are more interested in looking after the intimate parts than European women. Yes. So these treatments are very popular in the Arabic culture. They don't only look at their face. It's an important part of a woman's life. We don't talk about it because we feel shy, but they are happy to go and do treatments, and they are so well educated. So
Sharing is caring.
yeah.
Thank you very much again for all of the information. Check out Dr Marlain at King's College Hospital.
Thank you very much, Caroline.
Thank you.